Hello, welcome to my channel. Dear viewers, in our videos that offer some solutions for you and your problems, today we will talk about body staining and how to deal with the problems experienced by many pregnant women. Spotting during pregnancy can be scary, but it's actually quite common and usually nothing to worry about. First of all, let's talk about what the blemish marks on the body are. Spotting is light bleeding that occurs during pregnancy. It can be caused by a number of factors, including hormonal changes, implantation bleeding, or cervical irritation. While spotting is normal, it's always important to talk to your healthcare provider if you experience any bleeding during pregnancy. They can help determine the cause and whether any treatment is necessary. Now, let's talk about the different types of spotting. Implantation bleeding occurs when the fertilized egg implants in the uterus. This usually happens about 6 to 12 days after ovulation and can be mistaken for a light period. There are also sudden bleedings that can happen during pregnancy when the hormones in your body fluctuate. This can happen around the time you would normally get your period and is usually mild and short-lived. Another type of spotting is cervical bleeding, which occurs when the cervix is irritated. This can happen during sex, during a pelvic exam, or even just because of hormonal changes. It's usually nothing to worry about, but it's still important to talk to your healthcare provider if you experience any bleeding during pregnancy. So what should you do if you experience spotting during pregnancy? First, note when it happened and how much bleeding there was. Then, call your healthcare provider and let them know what's going on. They may ask you to come for an examination to determine the cause of the bleeding. In some cases, your healthcare provider may recommend that you rest and avoid sexual intercourse until the bleeding stops. In other cases, they may prescribe medication or recommend other treatments to prevent further bleeding. It's also important to remember that if you experience heavy bleeding or the bleeding is accompanied by cramping or other symptoms, you should seek immediate medical attention. This could be a sign of a more serious problem, such as a miscarriage or an ectopic pregnancy. In addition to seeking medical help, there are some things you can do at home to ease spotting during pregnancy. These include getting plenty of rest, fluid intake, and avoiding activities that can cause further irritation, such as showering or using tampons. Finally, it's important to remember that every pregnancy is different and some women may experience spotting while others do not. Trust your body and listen to what it's telling you, and don't hesitate to reach out to your healthcare provider if you have any concerns. Thanks for watching, and don't forget to subscribe to my channel for more pregnancy-related content.